we are so appreciative of the enthusiastic response we got to this event. So lots of people are getting on as they do. If you could introduce yourself in the chat, we would love to hear who you are, what organization you're with, and also 1 or 2 words about what you are doing for self-care. So introduce yourself in the chat, name, organization, and what you are doing for self-care. So I'm going to go ahead and start because we like to reward people who come on time. My name is Petra Silton. I'm the Director of Advocacy and Education for Thrive, the Alliance of Nonprofits for San Mateo County. And this event is called Thrive Swiftly, Managing Nonprofits Through the New Surge. The reason it's called Thrive Swiftly is because we pull this together really fast. We want to be able to respond to what's going on right now in the nonprofit world. And I think for all of us in the room, we heard loud and clear how challenging it is to run the nonprofits with how quickly everything is changing. So we wanted to be able to give you at least a snapshot in time as to what we can do, how we can run the nonprofits through this new surge. So we're really appreciative of our speakers today, Dr. Curtis Chan from San Mateo County Health, and Erin Montgomery and Gregory Gonzalez from AbilityPath. So with that, I want to do a quick introduction to Thrive, and then we will jump into the program. So many of you know that our purpose is to support the nonprofit community. We're over 200 organizations, but we are cross-sector. We have businesses, government agencies, elected officials, civic leaders, all part of strengthening the nonprofit sector. And we do this through our multitude of programs, including policy and advocacy, cross-sector collaboration, nonprofit capacity building. Here are some of the many programs that we've been doing lately. And next slide. So we do want to invite you to our next event, our Environment and Sustainability Thrive Action Group. We've been working on coming up with collective climate goals for the county. We came up with 2 over the course of last year that we're going to be prioritizing, and one is energy efficient homes and net zero buildings. And this afternoon at 3:30, we're going to have experts from our nonprofit community as well as from industry and from the government to talk about where we are in the county right now and where we're going. So you are welcome to join that. And now we will get into our program. I actually haven't seen if Dr. Chan is on yet. So I don't see that he's here, so maybe we will turn our program upside down while we wait for him. So let me, we have 2 parts to the program. And actually, I guess it doesn't really matter which way, if Erin doesn't mind, Erin and Greg, if you don't mind going first.
That's fine.
We invited Erin and Greg here because sometimes you just want to hear what other people are doing and how we're making it work. And Brian Nider, who is the CEO of AbilityPath, is on our board for Thrive. We're very grateful for that. And he suggested that they've been doing a great job at AbilityPath. So that's why we invited Erin and Greg to come and share with us how they've dealt with this. But I actually see Dr. Chan is on here. So I think we'll go back to our old, our old way of doing things. If Dr. Chan, if you are ready to be put on the spot.
Sure.
That would be great.
Sorry. Thanks for having me. Sorry to be late. Just scrambling from one meeting to the other. Really grateful for all the work that you all are doing in the nonprofit community. Seeing if I could share a screen right now. It's like I can. Am I sharing the whole screen?
Yeah.
Okay. Does it look like it's on? it doesn't look like it's
It's not presentation mode yet.
not present. Is this the right one? No. Here we go.
We just see the next.
Okay, here we go. Is it showing now, the whole screen?
Yeah, perfect.
So thanks so much again for inviting me. And I think, is it 10 minutes? Do you want me to say stuff in 10 minutes or how long do I have?
Yeah, 10 to 15 is great.
Okay, that includes questions or no?
No, we'll have questions after.
Okay. Thank you so much, Petra. And thanks for the partnership of Thrive throughout the pandemic and really bringing CBOs together through OCA as well too. So today is January 20th, I think, and things are going to change quite a bit in the next 2 to 4 weeks. And these are kind of the 5 points to think about. How do we manage these next 2 to 4 weeks, and how do we manage it in a way with your staff that will put us in the right position in the next 2 to 4 months? So 5 main points. Yes, indeed, community transmission is very high right now, but it's predicted to decrease throughout February. I'll show you some models for that. We're going to learn a lot more in the next 2 weeks, more clearly, that we know very clearly that Omicron is very transmissible, but how much more severe than Delta? And how do we communicate that to our communities? So welcome your advice too. As we work through these next 2 to 4 weeks, how do we pivot and support our staff, our workers, our volunteers to transition this into a endemic of hopefully what's a milder version of COVID, recognizing that some of our community members are still not vaccinated yet. How do we support our staff? And at the same time, how do we prepare ourselves for variants that might still crop up anywhere in the world? A variant of both either Delta or a variant of Omicron. The 4th point, I might be done in less than 10 minutes, Petra. So vaccines are very effective at preventing severe disease for Delta, Omicron. That's now been proven, and it's likely going to be effective for the next variant as well too. And the final message is that, during the endemic phase, we're not going to have so many health officer orders, but we're going to try to have clearer recommendations. And the recommendations that we need the support and the actual operationalizing from nonprofits, community-based organizations. I think our local governments can do it pretty well, our schools and school districts. So we want to limit the public health impact of COVID. So this is the forecast. I think the ones that California is using the most is the one in orange. It's the local epidemiologist model. And you could see this peak happening in like early to mid-January in terms of cases on the left. And on the right, as you know, the hospitalizations lag. So we're hopefully peaking in hospitalizations and the strain in our healthcare later on in the next few days, actually, and hopefully it'll start decreasing in February. And you could see for both graphs, you could see this rapid decrease in case numbers throughout February, and you could see we're in a much better position by March 1st. So, I think our overall message for our community is just really hold on tight, be really thoughtful right now in limiting your close contacts, and all these things we're asking communities to do. How do we organize it in a way that helps them get through February, but also helps them prepare for the next variant that might crop up? So one key thing is that, so we look at lab results from various different healthcare systems, and these labs are from Stanford, and you can see this is by weeks. It starts here from late October and all the way to last week. And you could see from Stanford amongst adults, this huge rise in green. And this is the number of SARS-CoV-2 or COVID virus that's being seen by the Stanford labs. And you could see for amongst adults, this makes up a huge proportion of the viruses they're isolating. They're not seeing much, or none of our labs are seeing much influenza A or B, not seeing much even para-influenza or adenovirus, which happens a lot in the summer, or rhinovirus, a little bit of RSV amongst adults. So you could safely assume that if you have symptoms of a respiratory infection, most likely it is COVID. And this is the data and the visualization for you to help understand that. Okay. And this is the similar results for kids. Now, kids pass along this virus called RSV, that's in orange, a little bit more, but you could still see this tremendous rise from October until this past week of how many COVID cases there are in green. These are SARS-CoV-2. And you could see for kids, if a kid has a runny nose and cough, you know, we used to say, oh, it's most likely rhinovirus, which is in like brownish gray, you can see right here. And that would be the case, or it's RSV. In the winter time, it's RSV. Like we say, look in October, you can see back in October, you can see my pointer there. You can see rhinoviruses in brown here. And so a typical season, this is rhinovirus. Oops, is that correct? Yeah, this is rhinovirus. And SARS-CoV-2, it's really, you know, you couldn't even see it in October for kids, such a small volume, but you could see it increase rapidly. And this is like when school was in session. This is why you're seeing so many kids getting infected right now. So yeah, we're holding our hats on for this. All of you are taking care of community members and organizations where there's multiple exposures. And anytime somebody is symptomatic, even for kids, you can still see it's a very good chance it's COVID is what you're seeing. So that's kind of the
Dr. Chen, sorry, can you go back one slide? It was
Yeah.
just a quick question about both in green, you have SARS-CoV-2 RNA, and then you also have coronavirus. Is that?
Yeah, like, yeah, that's Stanford has it that way, but that's the coronavirus, the non-SARS-CoV-1, which is SARS from that we experienced in 2002. So that's the normal seasonal runny nose coronavirus, which we're not seeing of. This is like that green is SARS-CoV-2. Yeah, that's confusing. Yes. Thank you.
Thank you.
So, you know, at the beginning of this pandemic, you know, I used to talk about this all the time about like what we need before we actually even went to shelter in place. You know, I was talking about R naught and R effective, and these are the main variables. So, you know, like when we're thinking not about just having these strict mandates and everything super prescribed about what you can do or what you can't do, it's really understanding the concepts of what's going to cause transmission. So this is from Professor Yang and Dr. Rutherford at UCSF, and it's really like the number of contacts per day, the probability of being infected per contact, how long the infectious period is in which you're in contact with others, and the population susceptibility to SARS-CoV-2 or to COVID. And you could see, you know, at this time, you know, and these were concepts that we prepared for pandemic flu, actually, in the from like, we did a lot of this from 2006 to 2010. And you could see even at that time, we knew that what we needed to do was to do these things. And again, it's going to be like your own CBOs and your own workforce following somewhat of CDPH guidelines and Cal OSHA guidelines, and then being able to make the best decision about, you know, when do you have staff gather for a meeting? When do you do a group meal together with your clients and host a social event or a community event, which is so important because people are feeling so socially isolated right now. And that's like, and that you're really determining like the number of contacts per day you're going to have. And then what type of masks to wear is really, and a function of that, it really determines the probability of being infected per contact, and whether it's indoors or outdoors. And then your infectious period, and that's the point about as soon as somebody's developing symptoms or has been in contact with somebody who probably has COVID at home, that's when you isolate the sick individual or you quarantine that individual from work. So if like you have a staff member with 3 people sick at home that's not been tested yet, that person probably has COVID. That person should be in quarantine and not coming to work. And again, this is the reason why we need vaccination as population susceptibility. So how it rolls out for you all is, so these are the blue different variables that I just highlighted for you. And this is like how we're understanding the data for the community epidemiology of what we're seeing in San Mateo County, United States, and California. So this winter surge is like that, from a population that's susceptible. Right now, a lot more people are susceptible than what we'll see in March because people are still getting vaccinated, particularly the communities that many of us are taking care of. Boosters were just approved in October and November for the general population. Same as children 5 to 11, it was just approved. So many families haven't gotten a chance to decide that this is the right thing for them. So they're still susceptible. And it's like I showed you from the graphs, the amount of virus that's in indoor places right now is very, very high because so many people are actually infectious and walking around. The weather is cold, so many of your activities are indoors and you have to plan for that. We're continuing to show studies that emphasize the importance of masks. Any type of face coverings for source control allows the virus to settle down, not be spread throughout the entire room, which is a huge issue for something that's very airborne, like the Omicron strain. And I think I showed you in the graphs that we're finding that during this winter surge, we're not seeing a lot of other viruses. Most of the viruses that are being isolated are COVID. And this variable that determines the duration of infectiousness, you can see from above. I'm trying to move my little screen here. You can see this high demand for tests. So because there's such a huge surge, everybody wants a test, and particularly because of policies allowing people to remove themselves from isolation and quarantine after 5 days, everybody wants to get a test right now. Get a PCR test. We're totally being all healthcare is being overwhelmed by the demand for tests, and same as the laboratories. And the Biden administration has just really started producing in mass quantities these rapid antigen tests, which supply is still totally not enough right now. We're expecting 5 times more volume of supply of tests in March and April than we have now. And this other variable, so that's the winter surge, which is high volume. And the other thing is the viral epidemiology. So things to confirm for Omicron, the vaccine still definitely decreased the likelihood of severe disease. So the boosters are needed to really decrease infections. If you had just 1 dose of a vaccine 6 or 7 months ago, the decrease in actually getting infected and transmitting to others doesn't get reduced that much. You really need the boosters to do that. So the next concept in terms of Omicron for a number of contacts. So this is extremely transmissible. Studies showing that's 2 to 3 times more transmissible than Delta. And what's causing is we're seeing from epidemiological reports that large outbreaks are happening from indoor social gatherings, particularly when people are removing their masks to eat and drink. Those are the major outbreaks. Like 70 out of 100 people are getting infected. That's a huge concern. So, and what we know is that, this virus, that even the small amounts that are airborne is causing infections. So smaller amounts than what was needed for Delta and Alpha, the UK variant. So what that means is that the CDC just recommended last week that some types of respirators provide more protection for wearers than others. And there's good guidance on the CDC website. And Cal OSHA is going to, soon change their guidelines too, in their language about what type of protection is needed. So actually, I don't know exactly when Cal OSHA is going to do that. So I think I'm not too sure what information is public or not, but Cal OSHA needs to change their guidelines for masks to protect workers. And and we're learning that the incubation period is faster, so it replicates so quickly in the upper airways, it seems like, that instead of people being infectious typically 4 to 5 days after being exposed, they're infectious, within 72 hours, 73 hours of being. So that's really like within 2 to 3 days, people may develop symptoms and they may be infectious 1 day before that. So antigen tests do work. PCR tests definitely work for Omicron, but the tests may be less sensitive. So that's something in this huge demand for Omicron, for antigen tests. That's something for everybody to understand. So I'm going to rush this next part here. So this is how am I doing on time, Petra? How much should I rush?
You're fine. Go ahead.
You let me know. I know we have another speaker. I missed who was speaking before, but feel free to scoop me out anytime.
Okay, you've got about 5 more minutes.
Okay, sounds good. So what we need to do right now is basically, I'm gonna move my little screen here. So this is the community epidemiology. It determines, so basically the major concept that we're going to ask community members to do is for endemic and future variants, you're going to need to vaccinate. You're going to basically limit the number of contacts you're going to have each day. And based upon the viral epidemiology and the community epidemiology, we're going to ask people to do things higher or lower, increase or decrease based upon the severity of Omicron, of the next variant, currently Omicron, and how much virus is in the community right now. Really important to emphasize indoor ventilations or be outside. How often you should be wearing a mask. When you should just decide to isolate if you become symptomatic, and when you should really emphasize testing. So that's our LIMIT acronym that correlates with the main variables for the reproductive number. So this is the same graph, and this is for February. This is for January and going into February. So for your communities, really emphasize the primary vaccines. That prevents death. Boosters are critically important for the elderly and also those in congregate living situations. Vaccines for children, I think the most important thing is prevent school outbreaks, allows them to stay in school longer. Children are still, doesn't seem to be at very high risk. The data isn't totally confirmed yet, but few people are saying that it's like substantially worse than like a seasonal flu for children. We're still waiting for some more official language from the CDC about that. So for the nonprofit communities is really limiting the size of events indoors for these next few weeks, particularly anything involving like singing with a lot of like eating and drinking, which people are removing masks, a lot of even just lots of conversations and shouting in a noisy environment when people are eating and drinking is really the environment where people are going to be infecting and transmitting to each other. So for all the facilities that you all operate, make sure that windows are fully opened and people are just bringing their coats and warm clothing. Ventilation is effective for Delta and Alpha, but wildly effective for Omicron. Very, very effective. So, make sure you allow outdoor activities and eating as much as possible. I talked to you, I mentioned the CDC recommendations for masks already. There's a new recommendations for isolating. If you're symptomatic, isolate for 5 days and then test quarantine for 5 days. And really important to emphasize to mask for 10 days because 20-30% of the people will still be infectious after 5 days. One of the reasons why they're reducing it to 5 days is not because of Omicron, but because the public health impact is lower now overall because so many people are vaccinated. So that's why, and I think it coincided with Omicron probably being causing a milder disease. But in some of the communities we care for, particularly those who have a higher proportion of unvaccinated population, they become at higher risk if we're isolating only for 5 days. So, I think I showed in an earlier slide, at this stage, don't wait for the test results to initiate activities that prevent transmission. Start isolating right away if you have a bad runny nose and a cough. That's probably not allergies. That's probably a viral illness. It's probably COVID. And this is my last slide. And this is how, I'm trying to get more community input and try to summarize. I think cases are going to fall by March. There's more and more data supporting that Omicron is much milder, probably 70 to 90% reduction in severe disease like ICU stays and deaths relative to Delta. We'd like to get more data that's published, but it's certainly not looking that it's 70 to 90% more severe. To me, it's 70 to 90% less likely to cause severe disease. So this is the optimistic scenario that by March, we'll be able to do something different. We'll be still, again, encouraging primary vaccination series for our communities that haven't been vaccinated yet because we think that there might be another variant. At that time, we won't limit so much of the indoor gatherings anymore. We won't have recommendations. Hopefully, we'll just tell people, don't attend if you've recently been sick or you have a lot of people sick in your household. We're still probably going to be recommending and emphasizing that ventilation is still really effective. Basically, if you have a lot of ventilation and your activities are outdoors, your two other things that are in green here, limit outdoor number of contacts and masks. We don't need to do that if you're in a well-ventilated space. You won't need to wear masks and you won't need to limit as much the number of contacts. So there's still some circumstances where we're going to strongly recommend masks, and some institutions such as schools, we recommend that schools require masks for some situations like inside the classrooms. Certainly for vulnerable populations and congregate living spaces like long-term care facilities, we still require to have masks. And I think the isolation will be, people may not be testing as frequently for using PCR testing, but they'll be using rapid antigen testing. And it'll be more, if you test positive, isolate yourself for 3 to 5 days. We're not going to have a big infrastructure to do case investigation and contact tracing for every individual. And it's really doing your own part for your community to make sure your colleagues at work, as well as the communities you're serving, your clients you're serving, your classmates are all safe. So you isolate for 5 days and you mask for a total of 10 days. So my last piece, and then there's, at the same time, we need to prepare for if there's another variant that's out there that's going to pop up in July, or May and July, like Delta, or in the next winter time. We got to get ready for that as well too. So That's my, so this is like our overall approach, that we want to get to a place where we're limiting transmission and limiting impact on public health. I think we need to have a balanced approach, because it's not just COVID transmission, but the toxic stress that all of us are experiencing, our clients are experiencing. We need a balance. What's the best way to limit transmission, but also we don't want people to be socially isolated and suffer more psychosocial consequences. So thank you so much. And I look forward to listening to, I think, Greg's presentation.
Thank you, Dr. Chen. We really appreciate that. I liked it. The second to last part was a little optimistic, and then the new variant, I'm like, oh. But anyway, we appreciate all of the information. And with that, we'll turn it over to Erin and Greg to talk about how AbilityPath has dealt with this. Thank you, Erin.
Thank you, Petra. I want to introduce myself. My name is Erin Montgomery. I'm the COO of AbilityPath, and I'm here with Greg Gonzalez, who is our operations manager. My pronouns are she, her, hers. And I'll give Greg an opportunity to introduce himself in a minute. I first want to thank Thrive for putting on this event, and also to thank everybody for joining. I think it's great that we come together as a community. We are prepared to share our story. We are not experts in this field, but I think all of us have had to learn through our experiences, and we are here to share our learnings. And also to learn from the group too, as questions come up and maybe other suggestions are provided. Our mission at AbilityPath is that we provide services for individuals with developmental disabilities, and we support the lifespan and families. So we serve a community that is at high risk, and individuals who are not able necessarily to get the vaccine or the booster, and even very young children who are not able to wear masks. So that definitely has informed our thinking, our approach, and putting individuals served first has been very important for us. We have some slides that we're going to share, and then we'll open it up for Q&A. I know I will go through our slides as at very high level, and we are open to sharing more detail if there's questions, but I definitely want to allow for time for Q&A for this group. So Kirsten, I don't know if you want to go ahead and share the slides. So managing through the new surge. I don't think any of us hoped that we would be here. We were, trending in a very different direction after the Delta variant. But very quickly in December, we all needed to readjust. Our organization had to react very quickly and navigate through the winter holiday weeks. And then, going into January, we're prepared to share what we're doing. So we're definitely going to be covering what has worked for us as an organization, what we have learned, but also what we are doing now. You can go to the next slide. So in introducing Greg, something that I want to recognize for our organization, Greg moved into his role as the operations manager before COVID hit, and then the pandemic hit, and we were able to leverage his position as a dedicated staff person to support COVID, both from a safety and compliance perspective, but also to do a lot of the research that has helped us, I think, to make informed decisions. He has been an amazing partner, and I wanted to hand it over to Greg just to introduce himself, and also just to talk about our approach in terms of how we designed our response plan and our protocol guidelines and how we use each of those documents.
Thanks, Erin. So yeah, my name's Greg, he, him. And like Erin said, the last 2 years, my role has kind of been heavily focused on COVID and helping the agency manage our response. So we do have a COVID response plan that we put in place, maybe it started June or May of 2020. But that plan is kind of a living document. So every time that new recommendations come out or the guidance changes, we meet as a group and kind of decide how we're going to update that. And then from that plan, we can build our protocols. So that's the day-to-day, for example, requiring N95 masks are similar for our staff who are working with clients in person, that sort of thing. Yep, and then communication. So we, in building that plan and those protocols, we talk to our staff, we talk to the families of the individuals we serve and the individuals we serve as much as possible, so that we've had countless town halls with the community and with our team, just to kind of explain where we're going, why we think that's the route we want to take, and then get their feedback to see if everyone's on the same page or they have different concerns that maybe we haven't thought about. And then data informed. So, a lot of my time has been spent looking at case numbers and hospitalization numbers and, case positivity numbers to kind of guide where we think is going to happen, or kind of where we are right now, just a snapshot to see if we need to either get more restrictive or, things are easing up and we can loosen our restrictions a little bit as well. But we're pretty slow with that implementation. So if a new recommendation comes back, that very next day you'll get staff who are emailing, can we adjust? Can we make this change? And typically we've taken a more conservative approach and taken time for us to have these meetings and talk as a group and decide whether or not it's appropriate for our agency to change our protocol or our plan at that time. We've always been very cautious and conservative. So the safety of both our team and the people we serve, as Erin mentioned, the people we serve tend to be a more vulnerable population. And so we want to be extra careful not to, pass the infection on as much as possible. And then we did do a lot of investing into staff training and equipment. So pretty quickly we had to switch to virtual. And so making sure that all of our participants had the technology, whether that's hardware or software, available to get the services that would be switching to virtual, and then making sure that the staff knew how to use those. So that learning curve of getting onto Zoom and making sure you're off mute and all that fun stuff for everyone involved. And then eventually we did start a regular testing service. So we use a company called Kyla, who comes out to our sites once a week to test all of our staff who are working with participants or clients, even if they are vaccinated, which has proved helpful during this last surge because we have a lot of asymptomatic, fully vaccinated people who are testing positive, and we're able to pull them out of in-person services before the infection can spread.
Great, thank you, Greg. So again, very high level, but I do want to highlight a couple of things around communication. Engaging with stakeholder feedback has really served us well. So it takes a lot of time and attention and reaching out. But when I talk about stakeholders, I'm talking about our board, I'm talking about our staff, I'm talking about clients served, as well as other community partners or referral agencies, just to make sure that we are understanding people's experiences, their opinions, their concerns, and even ideas that may be generated that we haven't thought about. And then we take that input and we assess, evaluate, we come up with a proposal, and then we share that proposal. And we always share the why. We're always going back to why are we doing this? And at the core, that is to prioritize people and safety first. So at times we need to explain, why we're making a decision. And what I found is that that open dialogue has helped people to even manage their own stress. And going back to being data informed, the research that we're doing and how we're sharing that information with our stakeholders, I think has been really beneficial. So we'll go to the next slide. In terms of vaccine policy, effective in October, we put together a new policy to require vaccines for all staff. And we have always strongly encouraged that with staff prior to that. So a lot of socialization in terms of what may be coming in the future and allowing people to ask questions, share their concerns, even talk openly about, hey, I don't want to do this. And for us to provide information and support for people to make their own personal decisions. We did allow and went through a review process for medical and religious exemptions. In early December, we started communicating with staff that we had regulatory oversight that would require some of our specific programs to get the booster shot in relation to who they are serving And so effective in January, we did put together a new policy requiring all staff to get the booster by 2/1. We have not received a lot of pushback in response to this policy. So that's been very positive, and I think what has served us well is the communication leading up to the policy effective dates, and then providing a lot of support for staff to be able to access and get their shots. Currently, right now, we're at 98.5% of staff who are vaccinated and approximately 50% who have the booster. Now, interestingly enough, since we did announce the booster policy, we are getting a lot of questions about, well, what are we going to be required in the future? Are there going to be additional booster shots? And I think there's a lot of hesitation and concern about this becoming just a regular ongoing requirement for employment. So a lot of questions being generated around that. We do allow for flexibility with timelines and paid time off to support staff to get the vaccine and booster. And that's been really important, and it does serve us well in terms of how employees feel supported by the organization. So we can go to the next slide. Team health. So wellness days, we added benefits for staff in last year, and we did it again this year, and that was very well received. Just giving some additional days for staff just to decompress, process their stress level, practice self-care. We do regular town halls, as Greg mentioned, which has really worked. I think a lot of people are experiencing isolation that Dr. Chan shared in terms of not having human contact. So we're trying to create that contact online as much as possible. We do provide closure pay in the event of program closure, which we have had to close some of our programs for short periods of time. And then looking at lost wages for employees who are exposed to COVID or are COVID positive due to exposure at work, we recently made a decision to provide payment up to 5 days for anybody who's impacted in that way. And that's going above and beyond because some benefits have recently expired that employees may have been able to access. And then we are always looking at our deadlines, our workload, our goals, and adjusting in response to the stress levels that our employees are experiencing, and also just being realistic about the impact of COVID in our programs. So I can go to the next slide. In terms of what is our response for Omicron and how is that different, we made the decision to return to virtual. So we had been operating in a hybrid space, some virtual, some in person. We were going back to more in-person programming, and then with Omicron, we made the decision to go back to virtual. There's an exception for our preschool programs and limited adult services. We did require a negative rapid test result of staff and clients before returning to in-person after the holiday break for programs that were operating in person. And we're continuing to test staff regularly. We have evaluated, should we test more often? Should we be only doing PCR versus antigen testing? There's a lot of dialogue around that. Some factors in terms of access and availability to testing has informed our decision. We are utilizing rapid tests, but we do PCR testing once a week. We're continuing to monitor the community spread, and we're communicating with our staff regularly about this. We are prepared to adjust our dates. We were going to return to in-person services in early February. For example, our children's therapy, pediatric therapy services, we're going to return in early February. And I am considering, and we're looking at not returning to in-person until late February or potentially March, which I think aligns with the information that we just heard. We are, obviously, I shared earlier in terms of our vaccine policy to require the booster shot by 2/1. And then the updated protocol to adjust for quarantine requirements, I have to say, has been one of the most challenging decisions to make and to navigate. There are recommendations out there, but as an organization, we ultimately have to make that decision and navigate that in different contexts depending on the programs themselves. So for preschool, there's certain regulations we need to follow versus our adult programs. And I don't know, Greg, if you want to just expand upon that or thinking around the 7-10 day rule that we're operating under right now.
Yeah, I'm sure everyone on this call has heard about the CDC changing, 5 days with a negative test and then wear a mask. And so a lot of our team was asking, are we going to do that too? Because being out of work for 10 days is burdensome for some people. But in talking with our team and the executive team and whoever we could get to join us for these conversations, 5 days just felt too short, especially in our preschools, which are the most open program we have. The kids are under 5, they can't be vaccinated yet. And the ones who can wear masks, often don't wear them correctly or well throughout the day. So 5 days just felt too short, and the staff was more comfortable with 7. So that's what we decided was best for our agency. On the 7th day of your quarantine, if you test negative with a rapid test, you can return. Otherwise, you would wait the full 10 days.
Thank you, Greg. And one more thing before we end, I just want to add is something that we are engaging with at our organization is looking at and learning about trauma-informed practices. So we've been part of a cohort that has been sponsored and led by First 5 over the last 10 months. And we've brought a lot of learnings from that cohort to how we communicate with our staff and also think about the experience that both our staff and clients served are having and to be sensitive towards what they're experiencing. So I just want to put a plug out there, within the nonprofit space, as organizations, for us as leaders, to really lean in and understand trauma-informed practices and how we can embed and implement and adopt. And with that, I'll turn it back over to Petra.
Thank you so much, Erin and Greg. It was really great to see how thorough you've been and how much you've really involved the staff and your clients in the conversations. Quick plug for a Thrive series that we're doing called Wellness Wednesdays. We just had our first one last week, and actually our recording is up on our YouTube channel if you want to see it. We're going to be doing every other month. We have the San Mateo County Department of Health actually is doing presentations for us, and it's been very successful. So I'd like to offer that to all of you. With that, I'd love to open it up for questions, either for Erin and Greg or for Dr. Chan. So there's one question in the chat, which is, would you share the policy language for the requirement of vaccines? I assume that's for Erin and Greg.
Yeah, definitely. I mean, I think we're very open to sharing our experience, and if you reach out to me directly or to Greg, we would be happy to share.
I cannot believe there are no other questions. Yes, we will provide emails. And actually, since that's a very specific question, Erin, maybe you could email that to me, and then we can send it out to the whole group, if you don't mind. You're on mute still.
My email is emontgomery@abilitypath.org, and I'll put that in the chat. So it's just my first initial and last name @AbilityPath.
Great. What practices did you implement around trauma?
Great question. I don't want to take up too much time in this space, but a lot of it comes down to communication and listening and holding space to gain a deeper understanding. We are openly talking about burnout. We are openly creating space for people to express their concerns. Adding the wellness days was definitely really impactful. We are implementing, I would say, wellness practices in our meeting spaces. Even the question that was asked earlier today about self-care that Petra put in the chat, doing things like that, asking people how they're doing, adjusting in response to people's, concerns and their stress levels. I can't emphasize enough how important it is to talk about this and model this, and I would say show your own vulnerability around it as a leader, and definitely something that we're exploring and looking at even how we embed that within our practices and policies as an organization. I encourage, if you have anybody who's interested on your staff, to lean in more, to support them, and developing internal champions who can encourage others and socialize, the learnings and bring in more of the peer-to-peer learning supports that I think could be very impactful.
Thank you. There's one more question in chat that I think is for the two of you as well. Has your organization been affected by the Great Resignation, and how have you adapted?
Yes, unfortunately, yes. It's very, very difficult to hire right now. And then we could do a whole webinar on just the Great Resignation and the challenges in the hiring market right now, and especially in the nonprofit space. We're finding to find qualified candidates is very difficult when we're hiring, but we're finding that people are making personal decisions in their lives, and they're either leaving the area, leaving the industry, taking a break, going back to school. So yeah, it's putting a huge amount of stress on our organization, on our HR team. We've had to increase our resources around recruitment, having to be very innovative in terms of how we approach our networking and posting of our positions. So yeah, it is a very big challenge, and I anticipate it's going to continue to be a challenge over the next 6 to 12 months. So, hang in there, everyone. Definitely, as a thought partner, if you want to reach out, I'm happy to connect. I think there are a lot of great ideas generating in terms of, what we can do, but ultimately the pipelines are sometimes non-existent, and the behaviors of people who are searching for jobs have really shifted and changed. I do encourage, to think about, how you can differentiate yourself and market the great things that you're doing and what kind of a work opportunity that you can provide. But I recognize it's very difficult right now.
And I want to add also, it has affected just our COVID protocols as well. We would love to still have cohorts of 12 kids as a classroom in the preschools, but it's just not practical. And admin team has to support staff for lunch and breaks, so we have mixing of staff between the different classrooms. So if there is an outbreak or a positive case, it ends up affecting more families than if we were able to hire fully and keep smaller class sizes.
And just one other comment, going back to the wellness topic, thinking about the experience that people have who are working in person, right? And leaning in and, I think being more flexible and being as supportive as possible, and, telling that story, when you are recruiting and inviting people to join your organization, because that's a big concern for people right now.
Thank you. Is there anyone who wants to share about their experience at their organization? We have a super quiet group today. Okay, well, if nobody has any other questions, then I will give you 5 minutes back to your day, because that is a huge gift. We have a tendency to schedule everything for an hour and don't give everyone the 5 minutes we actually need in between. So we will relish that. Thank you so much to Dr. Chan. And Dr. Chan, would you be willing to share your slides? Excellent. So we will, Kirsten, our fantabulous office coordinator, will send out the slides and the recording soon, so that you can share it with your staff and friends. So this was great. Really appreciate it. And thank you all for coming.